Welcome back to our special health show. We all know we need to brush our teeth and floss regularly, but for people with diabetes, taking care of the teeth may have greater implications. Joining me now is Dr. Roger Briggs from Briggs Family Dentistry. This is important to me since I have a lot of diabetics in my family. What is it that most diabetics don't know about keeping their teeth clean or teeth care?
Well, you know, one of the things they do know is that to deal with diabetes is like dealing with a bully. You know, we were just talking about bullies. And diabetes is really a bully disease. They come in pairs, though. They come with what we call periodontal disease. Everybody knows that as gum disease. So they come in pairs. And a person who's dealing with diabetes has a 300% increased risk of having gum disease. And a lot of diabetics don't know that.
What are the common signs and symptoms of gum disease?
Well, it's an inflammatory disease. So there's redness, there's swelling, there's bleeding. You know, if you have any bleeding at all when you're brushing and flossing, that's clinically significant. There's tenderness. And part of the reason it's a bully disease is that you don't know you have it until it's advanced because it's painless.
Now, is there something that has to do with free blood sugar that has to do with diabetes and dentistry? When
you're dealing with these two bullies, and I love that example because diabetes, there's 20 million people in the country who have diagnosed diabetes. There's 6.5 million that don't have a diagnosis on their diabetes. So the way these two bullies work together, if you have diabetes, you have a 300% increased risk of having gum disease. And if you have gum disease, it makes your diabetes worse. So the 20 free points that you get there, you know, that's diagnosed by how much sugar is in your blood when you wake up in the morning. So if you have too much, if we get control of your gum disease, we can lower that blood sugar automatically by 20 points.
So I know you have some before and after photos. Do those show what happens without treatment and then after treatment has happened?
Yes.
Well, let's go to some of those so people can see what happens. Tell me about those photos.
See, as you can see on that before picture, see that, especially on the bottom teeth, see that swelling and the redness?
Oh, yeah.
Now, in between those teeth, you can see the deposits that are on there, and it's the deposits that begin to allow these germs to invade into causing bleeding. I think on our next one we also have some. This is a patient, you can see the redness, the puffiness, the bleeding. You know, this patient had pretty much given up on herself. What's really exciting is when we helped her get control of her gum disease, she was excited about doing some cosmetic stuff. She was excited about getting control of everything else with her diabetes.
Will that mean people who have swollen gums like that, will that mean they will need surgery?
You know, that's really a good question. Everybody's worried about that old peel my gums back.
Yeah, my dad went through that, and he told him we needed to give him last rites because it was really painful. But that was back in the 80s.
You know, back in the old days, if I sent somebody over to the periodontist, 2/3 of them didn't even show up.
Wow.
There was no way they were going to get carved up like that. Now, dentistry is totally different than it was years ago. So those deposits that we were looking at, the first thing anybody does is get those deposits off because that's what allows those germs to get into your bloodstream. So that's not surgical. That's not surgical at all. We work with all kinds of things that help a patient to gain control of their periodontal disease without surgery.
Now, you brought some props, too, so people can see what kind of treatments and what things look like. You want to start with this one?
Well, this is probably the main one. I mean, what we're showing here is a missing tooth. You don't want missing teeth.
No, you don't.
You probably, the producer would want to talk to you about that if you had a missing front tooth.
I think they'd say something.
So you can see on this side of these teeth, these are healthy, and over here are these deposits. So if we can get those deposits off, then that redness and the discomfort and the bleeding goes away. You know, bleeding is an amazing thing because even a pregnant woman who has periodontal disease, she has an increased risk of an underweight or a premature baby.
Wow.
Oh, it's amazing how this stuff affects your whole body.
So if somebody got treatment for this, what would it cost them?
You know, that's a concern for many people, especially with the economy the way that it is. What we're finding is this has such an impact. Diabetes is the third leading cause of death. Diabetes is the leading cause of blindness in adults. Diabetes is big. It's epidemic proportion.
Right, because of the supersizing of America.
So when the government's thinking about how they're going to care for the American people, when insurance companies think about what's best for their pocketbook, they're starting to recognize that if they can control this periodontal disease and get a free 20 points of blood sugar down, they want to spend money on that. So there's medical insurance coverage now, and there's dental insurance coverage. So there's a lot of insurance coverage for that.
Yeah, so most of it would be covered in your standard checkup.
It is such a basic thing, it's covered.
So in between your doctor's visit, because you know what, I love dentists, I love what they can do, but you don't want to go too often. So what can I do at home?
You know, first of all, I believe, I think it was Albert Schweitzer said, inside everybody there's a little doctor. Well, I believe, and not to compare myself with him, but I believe inside everybody there's a little dentist. So at our office, we approach this whole thing from a team approach. Information, information, information. So the more information you have, and that's why we're here, is to give people information so they know what to work with. So there's websites, the two ADAs, American Dental Association, American Diabetic Association. Go on the website, learn everything you can there. You know, my team at my office is all really geared towards information for people that have to deal with diabetes. So if they can come there and get information, what we want is we want to teach them how to fish, not give them a fish. We want them to control it and do as much as they can at home.
Well, thank you so much, Dr. Briggs, and remember to get your teeth cleaned twice a year at least.
At least.
At least twice a year. And for more information, you'll find them on the web at briggsfamilydentistry.com, or you can call them at the number you see right there on your screen.